Hi everyone, I'm Bethany and I'm the Assistant Administrator at the Macon County Health Department. I know previously we've talked about some tips to remember when you're grocery shopping, and I will highlight some of those, but I also want to provide some reminders about, if you have to do banking or getting gas or going to a doctor's visit. As communities across the U.S., including Macon County, we all are taking steps to slow the spread of COVID-19 by trying to limit our close contact with people. We're all facing new challenges and questions about how to meet our basic household needs, like buying groceries or getting our medicines and completing banking activities. So just some ideas of how you can meet those needs both in a safe and healthy manner. So as we've talked about, shopping for food and other household essentials. First of all, the biggest thing to remember is stay home if you are sick. Avoid shopping if you are sick or showing any symptoms. Order online or use curbside pickup when you can, and only visit the grocery store or stores selling household essentials in person when you absolutely need to. So for instance, instead of going to the grocery store every day of the week, maybe just go once if you can. This will limit your potential exposure to others and the virus that causes COVID-19. While you are shopping, make sure you're doing all you can to protect yourself. Make sure that you stay at least 6 feet away from others while you're shopping and when you're in lines. Make sure that you're covering your mouth and nose with that cloth face covering when you do have to go out. And when you do have to visit in person, go during hours when fewer people might be there. For example, maybe early in the morning or late at night. If they do have special hours for higher risk populations, consider going then. And then also make sure that you disinfect the shopping cart and use disinfecting wipes if available. Try not to touch your eyes, nose, or mouth, and if possible, use touchless payment options. If you do have to handle money or your credit card or use a keypad, use hand sanitizer right after paying. Use hand sanitizer when you leave the store, and then make sure that you wash your hands for at least 20 seconds with soap and water when you do get home. If you're accepting grocery deliveries or takeout orders or any other type of delivery, limit your in-person contact as much as possible. So pay online or on the phone when you can, and try to accept deliveries without coming in contact with other people. So if that means that they can leave the delivery on your doorstep or on your porch with no person-to-person interaction, that is great. If you do have to come in contact with them, make sure that you stay at least 6 feet away from the delivery person. Once you've accepted, your delivery, make sure that you wash your hands or you use hand sanitizer after accepting deliveries or collecting mail. Again, you want to make sure that you wash your hands for at least 20 seconds and you use soap and water. Try to do online banking whenever possible, but if you must visit the bank, try to use the drive-thru or the ATM if one's available. Clean the ATM keyboard with disinfecting wipes before you use it. And when you're done, use hand sanitizer with at least 60% alcohol. And then, of course, like I've said, make sure that you wash your hands with soap and water for at least 20 seconds when you get home. Same with getting gas. If you can, use disinfecting wipes on handles or buttons before you touch them. And, maybe use gloves or disinfecting wipes. And then after fueling, use hand sanitizer with at least 60% alcohol, and make sure that you wash your hands for at least 20 seconds when you get home or when you get to somewhere that you do have soap and water. When you go to the doctor or you need to go get medicine, talk to your doctor online or by phone or by email if you can. Use telemedicine if available, and communicate with your doctor or nurse by phone and email. Make sure that you talk to your doctor about rescheduling procedures that aren't urgently needed. But if you must visit in person, protect yourself and others. So, let the office know if you think you have any signs or symptoms. Cover your nose and mouth with a cloth face covering when you do have to go out in public. Don't touch your eyes, nose, or mouth. Use disinfecting wipes on those frequently touched surfaces like handles, doorknobs, touch pads, all of those things if you can. Stay at least 6 feet away from others while you're inside and in lines. And then when paying, use those touchless payment options if they're available. As always, use the hand sanitizer after you've had to touch any of those surfaces, and then make sure that you wash your hands with soap and water for at least 20 seconds when you do get home. Limit your in-person visits to the pharmacy. So that means, maybe plan ahead. Plan to order and pick up all your prescriptions at the same time. And if it's possible, call your prescription orders in ahead of time. Use the drive-through or curbside or mail order or any of those other delivery services. Do the same for your pet's medications. And then check with your doctor or pharmacist to see if you can get a larger supply of medicines than you normally do so you don't have to visit your pharmacy as often. So hopefully these will help you as you try to navigate our new normal and complete all of your errands to keep you and your family safe. So thank you. Thanks for doing all you can. And if you have any other questions, you can check the CDC website, Illinois Department of Public Health website, or the Macon County Health Department website. Thanks.
Good morning. I'm Scott Wrighton, the City Manager in Decatur, and it's my pleasure to join you again to give you some additional information about the COVID-19 situation here in Decatur and Macon County. As you've heard reported mostly from the Macon County Health Department, our access to testing is increasing on a daily basis. The Macon County area and the health providers here are doing their part to achieve the governor's objective of getting 10,000 tests or more per day statewide. And our healthcare providers here in Decatur and Macon County have been able to handle and meet the needs of COVID patients without running up against limitations of capacity. That's good news. But as many of you know, that good news on the medical side and the numbers hasn't translated to opening up businesses sooner or opening them up faster and by certain categories. So that has changed as of yesterday when the governor announced his Restore Illinois program. The Restore Illinois program, which you can visit on the state's website, basically has 5 phases. And the phases, with each progressive phase, business becomes a little bit more open and the economy hopefully is able to become more active and vitalized. But whether or not we move from category 2 to 3 or 3 to 4 depends not on a set of rules or even requests from businesses. It depends on certain medical numbers. And those are how many positive tests there are, what kind of capacity the hospital has for handling new cases, how the medical community is set up to handle it, and then how widely available testing is. And as we make progress on those things, we move from one phase to the next. And with each phase, it's possible for more businesses to open. We are in the second phase of this 5-phase system that the Restore Illinois program announced yesterday from the governor's office, which means that we are implementing some of the more loosened restrictions that were announced by the governor on the 1st of May. And I'm going through all this because it's important for me to emphasize as strongly as I possibly can that going forward from here, the ability to open up businesses is not just going to be a function of what the healthcare community plus government are able to do. We can't get to phase 3 and eventually to phase 4 without your help. Because without the community's concerted effort and coming together, we can't reduce the number of positive cases while we continue to test. And we can't expect that the hospital will be able to maintain all of their capacities. So to the extent that you can continue social distancing, that you can stay home when you need to the extent that we use masks and all the other practices and bring these numbers down, then we will move to those next phases, and that's what we all want to be able to do. This is probably an oversimplification, but as long as there's an increase in the number of cases, and then we're going to be in phase 2, which is where we're at now. When we can flatten that line, then we're in phase 3. When it starts to go down, we're in phase 4. And what phase 5 looks like is a return not to the old normal, but to the new normal when all businesses can be open, but still practicing new safety procedures and protocols intended to limit the spread of the infection. So I want to say again that from here on out, moving to the next phase and opening up business is in your hands as citizens of Macon County and Decatur, just as much as it's in the hands of our healthcare providers and our local government public servants. And we look forward to partnering with you to do that. If you have some questions, we will provide additional information as more is available to us about how Restore Illinois will work in these videos in the future, along with our other partners. One of the good things, though, is that it's not going to be based on statewide numbers. It's going to be based on 4 separate regions. This is something that the city of Decatur and many other local governments were actively asking the governor to do, is say, don't treat us the same as the metro Chicago area. So our numbers will be mixed in with those in a central Illinois region, basically from the Indiana line to the Mississippi River, and sort of roughly, because it's based on county lines, but roughly between Hayworth on the north up there at the DeWitt and McLean County line to Vandalia on the south, and then from both east-west sides of the state. So that central Illinois region is where these numbers need to come down for us to move forward and open up the economy. So thank you for your support in the past and in the future as we move forward.